Grade 2 hamstring tear. Week 1. Before starting any rehabilitation exercises, it is imperative to follow the Price protocol. Protect rest, ice, compression, and elevation immediately after the injury. This is aimed at reducing the pain and inflammation and protecting scar formation. It is important to remember to have the ice on a mildly wet towel and not to apply directly on the skin. Ice should be applied for no longer than 20 minutes at a time, with at least 1 hour time intervals minimum between icing sessions, 2 to 3 times a day for the first 3 days. Week 2 and 3. The rehab program should start a week after the injury with stretching exercises designed to promote neuromuscular control within a protected range of motion. The hamstring stretch. This stretch is performed sitting on a cushioned mat and slowly bending forward, sliding the hands down the thighs. The patient should stop when the tension in the hamstring is felt. The position should then be held for 20 seconds. This exercise should be completed in 3 sets of 5 repetitions. It is crucial to stretch the uninjured muscles so that both legs reach a similar point of flexibility. Ideally, the patient should perform the hamstring stretch 4 times a day. This exercise should be pain-free. The patient should be able to stretch a little further as we progress each day. Note: if pain is felt on the first day of rehab, delay commencement of exercises. Although it is important to attempt highest level of range of motion, persisting through pain promotes improper technique and/or damage to new tissue. Therefore, do not push through pain or discomfort. Week 3 and 4. Once the muscle has been adequately stretched and the patient's normal walking becomes pain-free, strengthening exercises can be added to the program. Based on the patient's tolerance and improvement, gradual increases to the load should be made. The supported hamstring stretch. The patient starts by sitting supine on a cushioned mat with knees slightly bent so foot is flat on wall. Then begin sliding the heel up the wall as far as possible without feeling pain until stretch is felt. Perform 3 sets of 20 repetitions, hold for 10 seconds, 3 times each day. If this can be done without pain, progression to the next position can be made. The static hamstring flexion. The patient lies pronated and brings their heel up to their glutes. When patient is flexing knee, he should squeeze his hamstrings and glutes. Perform 3 sets of 20 repetitions, hold for 2 seconds, 3 times each day. Avoid locking your knee in extension and always keep tension in hamstring when doing the 20 repetitions. If this can be done without pain, progression to the next position can be made. The standing hamstring flexion. Standing, the patient brings the heel up to their glutes. Perform 3 sets of 20 repetitions and hold for 10 seconds for up to 3 times per day. A weight can be added to their ankle if it becomes too easy. Prone leg dropping. Patient lies prone with knee flexed and foot in air. The therapist should gently move the patient's foot back and forth and then drop the foot suddenly to have the patient catch the foot as soon as they feel it released. This helps the athlete regain their proprioceptive sense that may have been lost due to decreased function associated with injury. Execute 3 to 4 sets of 10 repetitions once a day. As strength builds, ankle weight should be added. Just relax your leg, yeah, I'll bring it up for you. Alright, we're going to go down again. Just let me know if it hurts at any time point. Good. Alright. There we go. That's nice. So we want you to catch it every single time. Try to do it as fast as possible. Yeah, just going down. Good. Alright. So now slowly. And we're going to do it one more time. Beautiful. Alright. Now you can just relax your leg. Week 4 and 5. Once full range of motion is achieved, the patient can begin more advanced functional exercises for the hip and knee through full unrestricted ranges of motion. For athletes, sport-specific exercises should be implemented at this stage. half squats. When performing this exercise, we will be doing 4 sets of 20 repetitions. Hold for 2 seconds and come back up without locking the knees. We should start with no weight. If patient becomes comfortable, add weight progressively. Patients should only do half squats once daily. Forward hurdle hops, over and back. Hop over the first hurdle, then over the second. As you land over the second hurdle, immediately hop backwards over the second hurdle, then walk to the beginning of hurdles. Use your arms explosively and tuck your knees into your chest. Maintain your balance by keeping your torso upright and your body's center of gravity over the hurdle. With full restoration of range of motion, strength, and functional abilities, if the athlete can jump, run, and cut without complaints of pain or stiffness at game speed, then they can return to sport. Thank you for watching our video. Best of luck on your journey to recovery.